Hey, Dell. Let's get you to come back in here.
Yeah.
It's early Tuesday morning in Pinaymootang First Nation. Here, everyone knows Dylan Offenlock.
Dell, did you eat breakfast or did you eat lunch?
Yeah.
You ate lunch at program, right?
Always with a smile on his face, he can often be found at the health center in the community.
Okay, Dell, sit here.
Dylan is part of a pilot program called AID that works with adults with intellectual disabilities.
Do they have a birth certificate and a status card? Is transportation usually an issue? What is your highest level of education? Like, some of that's good to know when we're helping you with things, right?
Here, his challenges are celebrated.
We highlighted it as a strength, not as a disability, right?
It's a first-of-its-kind project in Canada, an on-reserve program to help adults with exceptionalities who've aged out of care programs.
What kind of work have you been doing?
Cooking.
Nice. Did you do some, have you cooked so far? Or what's your favorite thing to cook?
Soup.
Oh.
And after the age of 18, just have zero resources available to them into reserve because they're adults. But what we know about people with exceptionalities or disabilities is that it doesn't go away. You know what I mean? So they continue to live with the disability with no resources.
There are regular monthly group activities and one-on-one support. Everything from cooking classes and grocery shopping, life skills to self-care.
These adults were living isolated at home with little or no stimulation. So because of the program, we get them out of the house. We train them for different job opportunities, educate them.
Make them part of the community. It's just one of more than a dozen pilot projects running at the health center on Pinaymootang.
Public health-wise, right now we're partnering with the University of Manitoba and with Heart and Stroke, talking about cardiovascular health, trying to figure out what kind of programming we can start in the community for improving people's cardiovascular health. So walking programs, nutrition programs.
Others have already been successfully tested and rolled out across the country because of the work they've done. They are working to create a more equitable health system.
And we're the first Indigenous My Health team in Manitoba. So what that is it helps, it's a partnership development that helps enhance services closer to home.
This health center has become central to not only the 1,700-person community, but the entire surrounding area.
Today, we see 47% of clients that come in from various areas, whether the surrounding First Nations or the non-Indigenous communities that utilize our services.
It's an open-door policy. No one is turned away. The closest hospitals in Ashern and Eriksdale are often plagued by staffing shortages and closures. People are often left trekking more than 200 kilometers away to Winnipeg for care.
We live in poverty. There's such a lack. Where we want to bring these services closer to home.
There has been a healthcare hole, and step by step, Gwen Travers and her team are filling the void.
Initially, when I had started, there was 8 employees at that time, and we're nearing 60 employees.
Some who've been there for more than a decade. The center offers a satellite pharmacy, regular doctor visits and blood draws, a women's clinic that offers pre- and postnatal care, services parents here begged for.
They had to travel all the way to Winnipeg for their kids. And if you've got quite a few kids at home, how do you organize transportation? How do you organize childcare?
But there's still work to be done, and it's been a steep learning curve. The First Nation is still recovering from the 2011 flood, which displaced many members for years. Coming home wasn't easy.
Now we've got mental health 5 days a week, which is amazing. And our mental health therapists often will even connect with their clients after hours, which is a huge benefit to people's mental health. Doesn't just stay within 9 to 5 hours.
But it's what helps drive Travers and her entire team to keep dreaming big. Next, she has her sights set on building an Indigenous care home for the First Nation.
I want to make sure that, our elderly Indigenous get the best care that they possibly can.
And now that the whole community is back on its land, she wants to make sure no one has to leave again. Brittany Greenslade, CBC News, Pinaymootang First Nation.